As you can imagine, COVID's impacted everybody throughout society. And in healthcare is a need, not a preference. So COVID's really affected us a great deal because all elective care, all regular care, routine care, preventative care has basically been put on hold, which is a real problem because a lot of times problems that are minor can become very major. And people who need help that's sort of routine or elective are having to wait longer. And this part that's unnerving is we don't have a sense of when this is all going to settle down. It's very important in ophthalmology. A lot of our treatment is to prevent worsening of disease or to treat disease that's ongoing. And these really are sight-saving treatments that patients are getting access to in the urgent situations. But there's also the unsort of known anxiety of patients not knowing if they're okay. They may be stable, they may not be. That's why they come to us as physicians, so we can monitor changes and prevent worsening of disease, particularly vision loss. It's a scary thing for people to even the idea of losing sight or going blind is terrifying. And if nothing else, we can give patients a reassurance that they're okay. And if they're not okay, a regular exam might show a problem down the road that we can prevent or avoid with timely care. Right now, we're having trouble doing that because we are not seeing regular elective patients. We still are taking care of the emergencies, making sure our patients have access to us, but it makes it tougher for patients and it makes patients much more anxious. And frankly, it makes us as doctors more anxious because we can't check on people the way we need to. And the public may not realize is we basically run a small business. As doctors, we have staff. Those staff have families and bills to pay, and we don't have work for them because we're not doing regular care, we're not doing surgery, regular routine surgical procedures are on hold. So our staff, for the most part, are more or less not able to work. We don't have work for them. And an interesting sort of part of this is that when most of us as physicians, we're on a fee for service payment, so we actually get paid to do work, to see patients, to do procedures. When we're not doing a lot of procedures or no procedures, when we're seeing only a few patients who are urgent, we can't really support the infrastructure that is in our offices. So we have to lay off staff. We have to still pay leases on equipment. We have to still pay rent for offices. We still have all these ongoing expenses that, unfortunately, it's going to be difficult to pay. And if we can't do that, then we can't provide care in the future. That's another frightening thing a lot of us are looking at is how do we keep our offices running? It's a much bigger issue than it may seem at first glance, but I'm hopeful and confident that working together with the Ministry of Health, working as physicians together with a great healthcare system we have in Canada, that we will figure it out. It's just going to be a few bumps along the way, I'm sure.